So hi friends, welcome back to my channel Circumstances Corner. Today we are going to discuss another medical surgical condition, pneumonia, and it is frequently asked question regarding its classification and management. So simply before going to definition, pneumonia is an infection of lung tissues or inflammation of lung tissues. Okay, it is caused by microorganisms. Okay, let's move to the definition. First one definition. It is an inflammation of lung parenchyma. It is important. Inflammation of lung parenchyma. See, pneumonia is a lower respiratory tract infection. Okay, so it affects bronchioles and alveoli. Okay, bronchioles and alveoli. So it is an inflammation of lung parenchyma and is caused by microorganisms such as bacteria, viral, fungal, mycobacteria. Okay, bacteria, viral, fungal, and mycobacteria, etc. Next, move to the epidemiology. Regarding epidemiology, about 450 million people are affecting all over the world and greater in children and old age because of their immunocompromised condition. So not immunized, they are less in immunity power. So they are very much affected. Then eighth leading cause of death. Okay, it is a pneumonia is having eighth leading cause of death. Next, we can move to the risk factors. What are the risk factors of pneumonia? First one, already told that age 60 or older. Okay, it is an prone time to affect any infection, not pneumonia. And smoking, then air pollution, then altered consciousness. Okay, altered consciousness means alcoholism, in head injury, anesthesia, drug overdose, or chance of aspiration. So that also leads to pneumonia. Then tracheal intubation, then upper respiratory tract infection. That is, improper treatment of upper respiratory tract infection will leads to LRT and then pneumonia. Then chronic disease. Chronic lung disease, diabetic mellitus and heart disease, cancer, etc. leads to pneumonia. Then move to the etiological factors. I already told that bacteria, virus, fungal agents and certain examples are for bacterial infections are Streptococcus pneumonia, then Chlamydia pneumonia, Staphylococcus aureus. These are common infections. Okay. Then virus infection, influenza, rhinovirus, etc. are examples of viruses. Then other infection agents such as pneumocystis carni. Next, we can move to the classification. What are the classifications of pneumonia? It is important. Okay, according to this, there are mainly 4 classification. You hear what I am telling. It is complicated in the slides because someone needs complicated, see, vast syllabus. They are already also included in this. See, you hear one thing, my voice. First one is according to the causative organism. Okay, according to causative organism, we already told that bacterial. Under that bacterial first one, which includes pneumococcal pneumonia is caused by streptococcus pneumonia. For examples, I am telling for your sake only. Okay, then staphylococcal pneumonia caused by staphylococcus aureus, etc. Okay, first one is bacterial. Next one is under the causative organism. Next one is viral. Next one is fungal. Okay, fungal, bacterial, viral, fungal, and fourth one is parasitic. Okay, these are coming under the causative organism classification. Okay. Next one is these all are coming under first causative organism, and next classification is according to the environment. Okay, environment which the pneumonia is got affected. Okay, first one is community acquired pneumonia. Okay, that is in overcrowded population there will be increased chance of pneumonia affection. That is community acquired pneumonia. Then hospital acquired pneumonia, that is nosocomial infection. Then pneumonia in the immunocompromised host such as HIV and AIDS. Okay, you already know. Then CA patients, etc. Then ventilator acquired pneumonia. Ventilator acquired pneumonia, VAP. Okay. Then third classification is according to the areas of lung involved. Okay, according to the areas of lung involved or affected, that is lobar pneumonia, multilobar pneumonia, bronchial pneumonia, interstitial pneumonia, alveolar pneumonia, necrotizing pneumonia, then segmental pneumonia. According to the name itself, it is very clear which areas are affected. Okay, first one is lobar pneumonia, multilobar pneumonia, bronchial pneumonia, interstitial pneumonia, then alveolar pneumonia, necrotizing pneumonia and segmental pneumonia. Next, we can see the fourth classification according to the cause. Okay, according to the cause. First one is bronchiolitis obliterans organized pneumonia or BOOP. Okay, it's mainly under COP also. It is mainly due to the exposure to certain chemicals, certain drugs, and certain birds in that certain allergic uh, items. From these are involved, that is known as bronchiolitis obliterans organizing pneumonia. Next one is eosinophilic pneumonia occur in response to infection with a parasite, that is eosinophilic pneumonia. Then chemical pneumonia, certain chemical substances. Then aspiration pneumonia, certain things to aspirate. Well, when we aspirate, it will enter into the respiratory tract and it will cause respiration pneumonia. And dust pneumonia is final one. Okay, dust pneumonia. So these are the classification. There are mainly four classification. Okay, next we can see the pathophysiology. It is a simple pathophysiology. First, the infectious agent or foreign substance or bloodborne organism or any aspiration content which enter into the body. Okay, infectious agent, foreign substance, bloodborne organism or any aspiration of gastric content will enter in the body. It causes inflammation. Normal inflammatory process will develop and capillary membrane permeability increases and it affects the pulmonary ventilation and diffusion. Okay, it will affect pulmonary tissue ventilation and diffusion. As a result, there will be exudate the protein rich fluid will be influx into tissues. Okay, so there will be alveoli filled with the exudates. Okay, then mucosal edema of alveolar membrane also occur. Okay, mucosal edema of alveolar membrane also occur. And this will lead to interferes with the diffusion of oxygen and carbon dioxide at the alveolar ends. Okay, interferes with the diffusion of oxygen and the carbon dioxide, and on the other hand, causing occlusion of alveoli resulting in decrease in or alveolar oxygen tension. Okay, it is occlude the alveoli resulting in decreased alveolar oxygen tension, and both will finally leads to hypoxia occur with the retention of carbon dioxide, then shortness of breath, then fatigue, crackles. Crackles are an important clinical manifestation, and decreased breath sounds. Okay, decreased breath sounds are seen in the pneumonia. Okay. Next, we can see the clinical manifestation. What are the clinical manifestations? See, once it is an infection, there will be signs of infection such as fever, chills and sweating, then productive cough. Okay, productive cough is important. Then shortness of breath, then pleuritic chest pain. Some people will experience a pleuritic chest pain, that is pricking pain. Then hypoxemia. The hypoxemia means decreased oxygen in blood, then fatigue, then tachypnea. Okay, tachypnea means increased respiratory rate. These are coming any respiratory. These are common for any respiratory infection. Then productive cough is important for pneumonia. Next, hemoptysis, that is blood in sputum. Then dyspnea, tachypnea, headache, crackle sounds over affected area. Then dullness sound percussion. Dullness means there is a fluid accumulation, so there is a dullness. Okay. Then decrease in breath sounds will be there. Then unequal chest expansion will be there. In the major cases, see complicated state, there will be abdominal respiration is also there in pneumonia. Okay. Then next we can move to the diagnostic findings. First one is history collection, then physical examination. Okay, through physical examination. From the history collection, there will be any history collection gives any say exposure to previous infection pneumonic patient. Okay, and so we can collect that also. Then chemical exposure or any bike. Then what aspiration will be there. We can access from the history collection. Then physical examination. Then chest X-ray. Then gram stain and culture and sensitivity. Then go for blood culture. Then immunological test to detect microorganisms. Then CT scan, MRI also take, then transtracheal aspirate can be taken, then fiber-optic bronchoscopy will be done, then ABG analysis will be done. Okay, history collection, physical examination, chest X-ray, gram stain and culture, sputum gram stain and culture, then blood culture, CT, MRI, then transtracheal aspiration, bronchoscopy, then ABG analysis. These all are coming under diagnostic findings. Okay. Okay, next we can move to the management. Okay, first we are giving the general management such as oxygen therapy, nutritional support, then fluid and electrolyte management, then bronchodilators. Nutritional support is very important because patient is very much dyspneic and taking very much metabolic rate. Okay, he or she is having very much metabolic rate, so he will be tired. So nutritional support, adequate calorie, increased calorie intake is very important. carbohydrate rich food will be given for them, nutrition support, then fluid and electrolyte management, then bronchodilators. It is important, bronchodilators, which may be injections or nebulization, which whatever may be, bronchodilators should be given. Then deep breathing and spirometry exercise and coughing exercise will be there. Then chest physiotherapy should be done, chest physiotherapy. Then percussion and vibration, that is coming under chest physiotherapy, and postural drainage. Okay, postural drainage should be there. Then nasotracheal suctioning. Then nasotracheal suctioning should be there. And finally, if not, see, if identified with the pneumonia, we can start antibiotics according to the organism, which may be gram negative or gram positive. Then we can move to the select the antibiotics and start the antibiotics and supportive treatments like bronchodilators and other supportive measures. Okay, corticosteroids also given to reduce infections. Okay, so we are giving this much of treatments. Okay. And next we can move to the nursing management. Okay, under the nursing management heading, first heading should be nursing assessment. Okay, under the nursing assessment, we have to assess the all conditions of the patient, and according to the assessment, we have to develop the diagnosis and interventions. Okay, next we can move to the nursing diagnosis heading. Okay, nursing diagnosis, under that, for any respiratory infection, there will be impaired gas exchange related to inflammatory process. There will be a diagnosis with the impaired gas exchange. Okay. So impaired gas exchange related to inflammatory pulmonary infection, evidenced by retinal secretion or anything else you identified. So next second one is ineffective breathing pattern related to decreased ventilation diffusion rate. Okay, ineffective breathing pattern related to decreased ventilation diffusion rate. So next one is risk for infection. Okay, before writing any care plan, there will be should be in mind that there will be one potential problem will be diagnosed. Okay, so that is risk for infection related to inadequate primary defense due to decrease in ciliary action. Okay. Next, fourth one is activity intolerance related to imbalance between oxygen and supply and demand, as well as there will be with the equipments. Okay, related to use of equipments like ventilator support. This may cause oxygen activity intolerance. This there. Okay. So these are coming under the pneumonia. It is a simple condition. So thank you for watching. Keep watching. Okay.